Have you ever had that feeling where food just gets stuck? Right in your chest? It's not just uncomfortable. It can be really frustrating and even a little scary. Well, in this guide, we're going to break down a condition called achalasia, which is often behind that feeling. We'll walk through it step by step. So, here's our game plan. We'll start with the basics. What even is achalasia? Then we'll get into the detective work, the symptoms, and how it's diagnosed. After that, we'll look at the different treatment options, what life is like after treatment, and some really practical day-to-day tips. And we'll wrap up with what your next steps should be.
All right, let's dive right in and start to unravel this mystery. For most people, this whole journey begins with some really confusing symptoms that don't seem to make a lot of sense at first.
This is the question, isn't it? It's the core experience of achalasia. It's more than just a little discomfort. It feels like there's a roadblock somewhere. So what is actually going on inside your body to cause this?
Okay, so think of your esophagus, your food pipe, as a hallway. At the very end of that hallway, right before your stomach, there's a muscular door. Normally when you swallow, that door swings open to let food in, then shuts to keep it there. With achalasia, that door is basically stuck shut. The signal to open just isn't getting through, so food and even liquids start to back up in the hallway. And I really want to stress this. This is a physical problem. It is not in your head. What's happening is that the nerve cells that are supposed to tell that door to open have been damaged. Now, we don't know exactly why this happens, but the leading theory is that it's an autoimmune issue. Your body is mistakenly attacking those nerves. And this is key. Our treatments are fantastic at prying that stuck door open, but they can't fix the original nerve damage.
Okay, so now that we know what it is, how do you and your doctors figure out if you actually have it? This is where the investigation really begins, piecing together all the different clues.
Now take a look at these symptoms. Trouble swallowing, what doctors call dysphagia, that's the big one, at 90%. No surprise there. But check out heartburn sensation. This is so interesting because in achalasia, that burning feeling usually isn't from stomach acid coming up. It's from old food and liquid just sitting in your esophagus, fermenting. And that chest pain can be so severe, some people mistake it for a heart attack.
And this is a really, really important one to watch for. If you find yourself waking up in the middle of the night coughing, or you keep getting chest infections, that's a major red flag. It could be a sign of something called aspiration, which is when all that backed up stuff in your esophagus spills over into your windpipe and gets into your lungs. That's a serious complication you need to talk to a doctor about right away.
So how do doctors pin this down for sure? It's usually a three-step process. First, they'll do an endoscopy. They use a tiny camera to look inside and make sure there isn't something else blocking the way. Next is a barium swallow. You drink a chalky liquid, and they watch on an X-ray as it goes down. With achalasia, they often see a classic bird beak shape where things get narrow. But the gold standard, the test that confirms it, is esophageal manometry. This test actually measures the muscle pressure and contractions inside your esophagus. It gives them definitive proof that the door isn't opening and the esophagus isn't squeezing properly.
Okay, so you've been through the tests, and you have a diagnosis. Now what? This is a huge moment, and it can feel like you're standing at a crossroads. There are a few really good treatment options, and understanding them is the key to making the best choice for you.
Let's break down the big three. First, there's pneumatic dilation, where they go in with a balloon and basically stretch that tight muscle open. Then you have the Heller myotomy, a minimally invasive surgery where they cut the muscle from the outside. They almost always pair this with a step to prevent acid reflux. And finally, there's POEM, the newest approach. They also cut the muscle, but they do it from inside the esophagus with a scope, so there are no scars on the outside. And wow, this chart right here really tells a story, doesn't it? When you look at how people are doing 2 years after their procedure, the difference is pretty dramatic. POEM has a 92% success rate. Pneumatic dilation, just 54%. That's a huge difference. And for a lot of people, this is a major deciding factor.
But, it's never just about the success rates. There's always a trade-off, and this is the big one you need to know about. POEM is incredibly effective and leaves no scars, but because it doesn't usually include that anti-reflux step, you have a much higher risk of developing acid reflux, or GERD, after the procedure. That's a really important thing to think about for your long-term quality of life.
And that trade-off leads us right into our next chapter, life after the procedure. Getting treatment is a massive step forward, but it's really the beginning of a new normal, not the end of the story.
And here is that trade-off in black and white, up to 47%. That is a huge number. Nearly half of patients who get a POEM procedure might end up with a new problem to deal with,
chronic acid reflux. The procedure fixes the blockage, but in opening that door, it can make it easier for stomach acid to come splashing back up.
This is exactly why the conversation doesn't end when you leave the hospital. Managing this new reflux is absolutely critical. Your doctor will probably put you on medications called PPIs to reduce stomach acid and protect your esophagus. And, as we're about to see, some simple lifestyle changes become a really big part of your daily routine.
So what does this all look like day to day? How do you actually navigate this new normal? Let's open up the practical toolkit and look at some tips and strategies from people who live with this every day. First up, eating. This becomes a whole new ballgame. Think small and often instead of big meals. You'll become a professional at chewing your food really well and eating slowly. Drinking water with your meals is also a game changer. It literally helps wash the food down. And you'll quickly learn what your problem foods are. Things like dry bread or fluffy rice can form a sticky plug, so blended, moist foods become your best friend.
Next up, gravity is now your absolute best friend. Seriously, always eat sitting up straight to let it do its work. You'll want to stop eating a good 3 to 4 hours before you go to bed, just to give your esophagus plenty of time to empty. Propping up the head of your bed with a wedge or some pillows is a must to prevent nighttime reflux. And here's a great little tip. Try sleeping on your left side. The way your stomach is shaped, this position can physically help keep acid down.
And here's something you might not think about right away. Taking pills. This can be a real challenge. Whenever you can, ask your doctor for liquid or crushable versions of your medications. If you have to take a pill, the trick is to take it with a ton of water before you eat so it has a clear runway to your stomach. Whatever you do, never, ever dry swallow a pill. It can get stuck and cause some real damage.
We have covered so much ground. So let's pull this all together and focus on the most important thing: how you can take control and be in the driver's seat of your own health journey.
These right here are your non-negotiables. These are the signs that mean you need to pick up the phone and call your doctor. If you're constantly struggling to swallow, losing weight without trying, or if you have any of those red flags for aspiration, like that nighttime coughing or frequent chest infections, it's time to get checked out. And always treat severe chest pain as an emergency just to be safe.
And finally, I want to leave you with your most powerful tool: having the right questions to ask. Go into your appointments prepared. Ask about your specific subtype of achalasia, because that can affect treatment choices. Talk through the pros and cons of each option for your body and your lifestyle. Ask about your doctor's experience. And most importantly, make a plan for the long term. Ask how you'll work together to monitor for acid reflux. Being prepared like this is honestly the single most powerful step you can take on this journey.